An infectious disease expert, Professor Alfred Yawson, has asked the Ghana Health Service to strengthen its monitoring and surveillance regime to ensure the spate of wanton flouting of COVID-19 protocols by the public does not derail efforts made in reducing fatalities from the virus comparable to other countries on the continent and globally. He told Roland Walker on the AM show monitoring can only be stepped up if collaboration with other institutions are intensified across the country.
There are multiple things we need to consider, and generally what I believe the Ghana Health Service was putting across was that the cumulative figures, that is, all the persons we've tested positive match, those numbers will certainly continue to increase. However, it is the rate of increase as well as the number of recovery. So if our recovery exceeds the new infections, then with time, you will see that gradually, that in all sincerity may be the ones that will effectively transmit the virus from one person to the other. As we move on, let's say you are 28,000 and your recoveries are 27,000, which means effectively the active cases are only 1,000. That is, for example, if we do not continue on the trajectory and we relax and do things otherwise, bring people together in masses and do things that will increase the rate of new infections, then the number of active infections will continue to increase, and it's from among those that unfortunately some may perish. What we need to continue to observe and to do is to reduce the number of new infections being recorded. Fatality rates have relatively been lower. Multiple factors could account for this, and we will also say that the way we handle the epidemic right from the beginning, active surveillance, enhanced surveillance. So in that time, we got those who were infected, who otherwise would have spread it rapidly in the communities. We try to confine this to the minimum. So it is generally the approach we took as a nation in terms of surveillance, contact tracing, enhanced surveillance, and getting all those who had come into contact with others quickly into isolation, quickly into treatment. Once you bring people into treatment early, then you are able to manage the complications. And here we must pay a lot of tribute to our health workers who are in the front line, who are doing everything, sometimes under very difficult conditions, to save the life of our folk. And we must commend them. They've done quite a great job, and they continue to do. The testing is important, it's critical. We need to continue to test. It is only through testing that we see the real picture. Therefore, the fact that you test more, you get more, it's important, but it's not adequate. We still need to continue to test. And all the challenges, we should, as we go on, try as much as possible to reduce the turnaround time for receiving results. So as for testing, we need to continue to test as we are doing. We need to put in measures to decentralize the testing as much as possible so that all areas of the country will have capacity to test.
He also commented on the recall of students back to school amidst the COVID-19 pandemic.
Once we got the children into school in the first place, there was no reason to send them back home, because that was going to create a much bigger problem. So once they've gotten into school and we know where they are in relatively more confined areas, then all we needed to do was to improve our targeting and tracing. Wherever a case is detected, you move in, you do all the right things, and still keep the children in school. So now that they are in school, all must be done to ensure the safety of the children, the safety of the teachers, and then give assurance to the parents that the children are being well taken care of. And then we can hopefully see them through their exam, which is for us the crucial point. Once they get through the exam, then measures can be taken in put in place to then send them back home safely.